Hello everybody. The topic of discussion for today is part second of the intercostal spaces. At the end of this session, the participant should be able to describe intercostal arteries, both anterior and posterior, should be able to describe intercostal veins, both anterior and posterior, should be able to describe lymphatic drainage of intercostal spaces and intercostal nerves, both typical and atypical. As regard the clinical relevance, the participant should be able to define girdle pain, describe shingles, and describe the clinical anatomy of internal thoracic artery and role of neurovascular bundle in the caries spine. We start with the intercostal arteries. There are two sets of intercostal arteries on each side. Out of these, 11 posterior intercostal arteries are present on each side, and 9 pairs of anterior intercostal arteries are present on each side. 10th and 11th spaces on each side all are solely supplied by posterior intercostal arteries. Now the origin of intercostal arteries. First, the posterior intercostal artery. First and second posterior intercostal arteries originate from superior intercostal artery, a branch of costocervical trunk, which itself originates from subclavian artery, a branch of arch of aorta. Third to 11 posterior intercostal arteries originate from descending thoracic aorta. As regard the origin of anterior intercostal arteries, first 6 pairs originate from the internal thoracic artery, a branch of subclavian artery. Lower 7 to 9 pairs of anterior intercostal arteries originate from musculophrenic artery, a terminal branch of internal thoracic artery. We start with the posterior intercostal arteries. There are 11 pairs which are divided into two groups as regard their origin. First and second posterior intercostal arteries originate from superior intercostal artery, a branch of costocervical trunk which itself originates from the subclavian artery. Third to 11 posterior intercostal arteries are named as aortic intercostal arteries as they originate from the descending thoracic aorta. Each of the 11 pairs give a collateral branch which travels along the upper border of the lower rib. Right aortic intercostal arteries are longer because of the position of the descending thoracic aorta. They cross vertebrae behind esophagus, thoracic duct and azygous vein, which are covered by right lung and pleura. Left aortic intercostal arteries run leftward. They are covered by left lung and pleura. Upper two vessels are crossed by left superior intercostal vein and lower vessels are crossed by hemiazygous vein. As regard the branches of the posterior intercostal arteries, each gives a dorsal branch which is named as spinal branch for the spinal cord, and itself divides into lateral and medial cutaneous branches. The collateral branch travels along the upper border of the lower rib and anastomoses with the lower anterior intercostal artery. Lateral cutaneous branch is given in the mid-axillary line and divides into anterior and posterior branches for the lateral aspect of the body, whereas the posterior intercostal artery continue as the terminal branch, which anastomose with the upper anterior intercostal artery. Anterior intercostal arteries are branches from the internal thoracic artery, a branch of subclavian artery, or the continuation of internal thoracic artery, the musculophrenic artery. There are two arteries in each space, and there are total 9 pairs. 10th and 11th spaces are supplied solely by the posterior intercostal arteries. These arteries travel in the neurovascular plane that lies between internal intercostal and pleura. Upper 6 pairs originate from the internal thoracic artery, whereas the 7th, 8th and 9th pairs originate from the musculophrenic artery. Upper artery in each space travel along the lower border of the upper rib and anastomose with the posterior intercostal artery, whereas the lower artery in each space travels along the upper border of the lower rib and anastomose with the collateral branch of posterior intercostal artery. Intercostal veins are a group of veins which drain the intercostal spaces. There are two main subgroups, anterior and posterior intercostal veins. Anterior intercostal veins are two in each space and are present just like anterior intercostal arteries only in the upper 9 spaces. 7 to 9 join the vena comitans of the musculophrenic artery. 4, 5 and 6 join the vena comitans of the internal thoracic artery, whereas first, second and third join the internal thoracic vein which is formed behind the third costal cartilage and itself drains into brachiocephalic vein. As regard the posterior intercostal vein, one is present in each space is the main channels, but posterior intercostal veins, in contrast to anterior costal vein, differ on right and left side of the body. On the right side, 5 to 11 posterior intercostal veins drain into azygous vein. Second, third and fourth form superior intercostal vein and ultimately drain into azygous vein. And first posterior intercostal vein drains directly into the right brachiocephalic vein. On left side of the body, 9 to 11 posterior intercostal veins drain into hemiazygous vein, and 5 to 8 drain into accessory hemiazygous vein. Second, third and fourth join to form left superior intercostal vein, and this superior intercostal vein drain into left brachiocephalic vein. The first on the left side, like the right side, drain directly into the left brachiocephalic vein. Before we start with the intercostal nerve, let us have a review of the spinal nerves. All the spinal nerves are mixed nerves which convey sensory, motor, and autonomic signals between the body and the spinal cord. In total, there are 31 pairs which are divided into 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Now, each spinal nerve has got multiple rootlets which converge to form two roots. a ventral which is purely motor and a dorsal which is purely sensory. The dorsal has got a circumscribed enlargement on it which is named as dorsal root ganglia. These roots, ventral and dorsal, they travel in the vertebral canal, unite in or near their respective intervertebral foramen to form the spinal nerve, which is about 0.5 centimeter long. It immediately divides into two rami, ventral and dorsal. Both ventral and dorsal rami are mixed nerves. Each ventral ramus of the thoracic nerve is named as intercostal nerve. There are 11 pairs of intercostal nerves which are divided into two main groups: typical intercostal group and the atypical intercostal nerve group. First, the typical intercostal nerves. These are continuation of anterior or ventral rami of third to sixth thoracic nerves, hence are mixed nerves. Each intercostal nerve runs along the lower border of corresponding rib in neurovascular plan in subcostal groove. Initially, on the posterior aspect, it lies between internal intercostal membrane and pleura. On the lateral aspect of the body, it lies between internal and innermost intercostal muscle, and on anterior aspect, it lies between internal intercostal muscle and pleura. Close to the origin, each intercostal nerve gives a white ramus and receives a gray ramus from the sympathetic trunk. Postsynaptic sympathetic fibers innervate smooth muscles of blood vessels and sweat glands. Each intercostal nerve supplies anterolateral aspect of the trunk. As regard the branches, close to the angle, each intercostal nerve gives a collateral branch which runs along the upper border of lower rib, and this collateral branch is motor for the intercostal space muscles. Main trunk of the intercostal nerve is almost wholly sensory for the intercostal space, including parietal pleura and periosteum of the ribs. Intercostal nerve gives a lateral cutaneous branch in the mid-axillary line, which divides into anterior and posterior branches and supplies the skin of the lateral aspect of the trunk. Main trunk itself continues as the anterior cutaneous branch. It pierces anterior intercostal membrane and divides into medial and lateral branches to supply this skin of the anterior aspect of the trunk. Second group of intercostal nerve is atypical intercostal nerves, which comprises first two and last five intercostal nerve. First, the first intercostal nerve. It is the continuation of anterior ramus of first thoracic spinal nerve, which bifurcates around the neck of the first rib into superior and inferior branches. Larger superior branch joins brachial plexus, whereas the smaller inferior branch, which is named as first intercostal nerve, travels in first intercostal space, has got no lateral branch, and ends as first anterior cutaneous branch on the anterior chest wall. Second intercostal nerve is just similar to typical intercostal nerve. It is anterior ramus of second thoracic spinal nerve, having one difference from the typical intercostal nerves. It has got a large lateral cutaneous branch which does not divide. into anterior and posterior branches. This lateral cutaneous branch supplies base of axilla and upper part of medial side of the arm, hence is named as intercostobrachial nerve. Second intercostal nerve and as second anterior cutaneous nerve on the anterior aspect of the chest and innervate the anterior aspect of the trunk. Notable point is that in acute cases of coronary artery disease such as heart attack, patients usually feel left-sided pain in axilla and arm. This pain is because of a cardiac rapid pain mediated by this nerve. Third component of the an atypical intercostal nerve comprises lower 5 intercostal nerves, that is 7th to 11th pair of intercostal nerves. As these nerves innervate not only the thoracic but also the abdominal wall, they are named as thoraco-abdominal nerves. In thoracic wall, in each space, each nerve behaves like a typical intercostal nerve, and gives a lateral cutaneous branch which divides into anterior and posterior branches and innervate the lateral aspect of the trunk. At anterior end of each space, each intercostal nerve courses behind costal margin and enters the anterior abdominal wall. In abdominal wall, each intercostal nerve travels between internal oblique and transversus abdominal muscles. After piercing anterior rectus sheath, it becomes the anterior cutaneous branch which innervate the anterior aspect of the anteabdominal wall. Each intercostal nerve also supplies parietal peritoneum and the diaphragm. One notable point is that fourth intercostal nerve carries signals from slowly adapting and rapidly adapting mechanoreceptors, which are especially densely packed under the areola, and the fourth intercostal nerve innervate the areola part of the breast. Stimulation of these mechanoreceptors trigger oxytocin release into the bloodstream, which causes contraction of the myoepithelial cells and the start of lactation. It is an example of non-nerve innervation muscular reflex. Now, lastly, the lymphatics of the intercostal spaces. There are two groups, anterior and posterior. Anterior group of lymphatics drain lymph from the anterior part of the spaces into internal thoracic nodes which lie along the internal thoracic vessels. Efferent from these nodes unite with those from tracheobronchial and bronchocephalic nodes and form the bronchomediastinal trunk, which joins differently on right and left side. On the right side, it opens into right lymphatic duct, whereas on the left side, it opens directly into the thoracic duct. As regard the posterior group, this group drains lymph from posterior part of the intercostal spaces to posterior intercostal nodes which lie on the heads and necks of the ribs. Efferents from lower 4 to 5 spaces unite to form a descending thoracic lymph trunk which opens into cisterna chyli, whereas efferent from the upper spaces drain differently on right and left side. On left side, they drain into left bronchial mediastinal lymph trunk, which opens into thoracic duct, whereas on the right side, they drain into right bronchomediastinal lymph trunk, which opens into right lymphatic duct. Lastly, the clinical anatomy. Irritation of the intercostal nerves produce severe pain, which is referred along the root of the nerve. In case of upper nerve, it is referred to the anterolateral aspect of the chest, whereas in case of lower nerves, it is referred along the anterolateral aspect of the abdominal wall. It is also named as root pain or girdle pain. Shingle is the herpes zoster viral infection of the motor neurons. Virus resides in motor neurons and travels along the nerve fibers. In case of intercostal nerves, it produces rash and referred burning pain along the root of the nerve. In case of second thoracic nerve, referred pain is mediated through the intercostobrachial nerve, so it is felt along the upper medial aspect of the arm and in the base of the axilla. Internal thoracic artery is used as a graft in coronary artery narrowing. The artery is mobilized and its distal cut end is joined to the coronary artery distal to its narrowed segment. Left internal mammary artery is connected with the left anterior descending artery, and the right internal mammary artery is connected with the circumflex coronary artery. In caries spine, pus tends to track along course of the neurovascular bundle, hence may point at sites of exit of the branches of thoracic nerve, that is dorsal primary ramus, or cutaneous branches of ventral ramus, that is lateral and anterior. Comments and suggestions will be welcomed. Thank you for listening and watching.